My name is Dr. Elvira Paravicini. I'm a neonatologist at New-York-Presbyterian Morgan Stanley Children's Hospital. We have here one of the most prestigious neonatal intensive care units, and our mission is to save babies' life. We do the impossible to rescue their life and send them home happy and healthy with their families. However, there are infants who are affected by what we call life-limiting conditions. These are illnesses that make their life really short, and they are not amenable of medical or surgical treatments. We believe, though, that no matter how brief, each baby's life is precious and needs to be welcomed and cherished. For this reason, the Neonatal Comfort Care program is there, available for these babies and their families, to allow them to celebrate the day of their birth and also to enjoy the beauty of their short life, but as much as possible.
Families come to our program after a diagnosis of a life-limiting condition in their fetus, and so they come here looking for some support, some help with the journey that they find themselves on, a roadmap, if you will, to help them continue forward. Families are frightened, and of course they're very saddened by the news that their child will not have a long life. And so we try to be welcoming and supportive. We have a large number of people that help with this comfort care program: doctors, nurses, social workers, child life specialists, pastoral care department, all help to provide these families with a safety net so that they are well taken care of, well supported, and have some practical things that they can do that help them through this difficult time.
We understand that this time is very difficult for families, and so we are here to support them through the journey. And this journey usually starts during pregnancy at the moment of the baby diagnosis, continues throughout the baby's life and beyond. We like to meet with families early on in pregnancy, so we can explain to the family the condition that affects their baby, make a plan for the delivery, and also explain to them the care we'll provide once the baby is born. We will address medical needs, but also those needs that are unique to babies, like the need to be welcome, the need to bond with the family, the need to be warm and clean, the need to feed. Little babies love to breastfeed and bottle feed, and they need to be pain-free. In one word, they need to be comfortable.
They come to see us prenatally, so that's where usually we begin our relationship with them. And then we follow them through labor and delivery. Hopefully we are able to be at the delivery. And sometimes babies will only survive in labor and delivery in that area. If they survive longer, and even if they don't, mothers can bring the babies with them to the postpartum area. And the nurses there are also trained to help these families. Sometimes families would prefer that their babies come to the NICU, and so that can also happen. And then they can visit their babies here in the NICU. We have 2 rooms that are set up very much like a home-like environment, and families can have music, they can have privacy, they can read to their children. We have a cradle, they can give a bath, we have a bathtub, spend some quality time with their babies if that's what they choose. Babies who live long enough to go home can go home with hospice, and we can also transfer them to an inpatient hospice facility if that's what the families prefer. Our hope is that we provide not only a beautiful, comfortable life for their baby, but that there is some sense of peace in this family as they move forward in their lives.
When we first found out that our little baby, Chaley Philomena, had 2 serious conditions, trisomy 18 and spina bifida, we didn't even know what. We had heard of spina bifida, but we were unaware of trisomy 18. We did some research and found out that it really meant that she would have a short life. She may not make it to term, we were told, or her time with us may be minutes, days, or weeks, or months. So all of these things went through our mind, and we went for a whole series of tests and ultrasounds, and we needed to be at a hospital that had a NICU unit, so the local hospital where all of our other children were born, we couldn't go there. So we went to the next closest hospital to us, which had a NICU, but they could not address her spina bifida problem. So if she needed surgery, we couldn't stay there. We would have to transport her to some other hospital. So at that point, they explained to us that we needed to find a pediatric neurosurgeon that could help us if she was healthy enough and strong enough to have surgery. That was very overwhelming because it meant getting on the phone and calling different surgeons and see if they would take a look at our situation. That was a Friday afternoon. 3 days later, we got a call Monday morning from our genetic counselor that we had been seeing, and he said, there's a doctor in New York City that wanted to take a look at our situation and that she's going to call. That very day, Dr. Paravicini called us, and we met her 2 days later. And after that, everything became so much easier.
She sat down with us and she said, this is a very special baby, and the baby just has a little extra, she needs a little extra care, and we're going to do everything we can to make everything comfortable.
Dr. Paravicini, she introduced us to Fran, who was wonderful through all the meetings we had together. She helped us find the pediatric neurosurgeon that we met with him, and he explained what would happen if she was strong enough at birth that she would be able to have the surgery here. And one of the biggest things that I found the most helpful, and I think probably I'm the most thankful for, is they welcomed our other children and our family to come that day and to be present in the hospital, so that the moment Shaylee was born, within a few minutes, my whole family was in the room together. And Shaylee only lived a little less than an hour. And so those moments were so precious. They were in the hospital. My children were able to hold her.
We were able to baptize our baby and at that time. And the baby was with us for a short time, and you could see in her eyes, and everybody got a chance to hold her.
That was the joy, and I think if we were anywhere else, that would not have happened. We would have made phone calls, and the children would have to, be brought in, and those critical moments of being together would have been lost. So Dr. Paravicini and her whole team organized everything, the Child Life program, so that we could all be together. That day, the Child Life program organized having the child's handprints with Shaylee's footprint on canvas. So that was a real treasure that we have in our home. All 8 of the canvases lined up with the baby's footprint, and we'll have that forever.
Our team activities require a lot of effort, and we really need a big motivation. And regarding this motivation, I was really inspired by a frame that a mother embroidered for her baby. She put this frame above the baby's crib, and the frame says, "You are loved." And I believe this is our motivation. We work for our babies so that they can be welcome and loved by their parents.